and then I'm going to turn it over to Gary. And Gary, it's all yours.
Okay, well, thank you everyone for joining us today. My name is Gary Glauberman. I am a faculty member at the University of Hawaii School of Nursing, and I have been tasked by the Department of Health to coordinate this new project for face mask observations. So we're working in concert with the Department of Health to develop a new metric for preventive behaviors against COVID-19 in our state, and one of those metrics will be observations of the use of proper wearing of face masks across the state in different communities. So today I will give you information about how to participate as a volunteer in this endeavor. And I hope that you consider volunteering, because we do need volunteers across the state. You guys will be joined by other volunteers from the UH system, such as the Kauai Community College Nurses, UH Manoa Nursing, UH Maui Nursing, and the MRC members across the state as well. So very grateful that the Rotary Club has thought to include their volunteers in this important endeavor. And I'm joined by Daisy, who's our GA, our graduate assistant on this project, and she does a lot of the communications and coordination on our behalf. So thank you all for joining us today, and Daisy will do a component of this training as well. I'm going to share my screen with you folks. And I will share with you these slides. Make sure, because can everybody see these slides right now? Okay.
Yeah, looks good, Gary.
Okay, great. So let me just move this over here. I lost some piece of my slides here. Okay, now I lost Zoom. Man. Sorry. Set my screen up a little. Okay. Okay, so let me just click on this here. Okay, so the purpose of this project is to monitor the ongoing use of face masks and face coverings by the public in Hawaii, to track the extent to which the public is adopting face mask wearing behavior in public spaces. And so the data that's collected by this project will be included in the Hawaii Department of Health COVID-19 data dashboard, which is publicly available right now. If you Google Hawaii COVID-19 data dashboard, you'll see the new dashboard that's been developed to track different metrics that have been linked to COVID-19 response in Hawaii. And so we always have had the number of deaths, the number of hospitalizations, the number of ICU, the number of testing. But what we lacked was the number of people taking up preventive behaviors. And so that's the thing that this project provides the state with, is a sense of what are the behaviors that people are taking up to prevent against COVID-19, and what are those patterns. So the way that we're going to do this is each week we're going to have volunteers conduct observations regarding the use of face masks in designated public spaces around the state. The volunteers will work preferably in teams of 2 or as individuals based on location they're assigned. We're selecting locations that are considered to be safe and in the general public, in public areas. So shopping centers, beach parks, other places that people gather that are public. Volunteers will conduct observations each Saturday starting at 9 a.m. For up to 2 hours, or until a quota of 100 observations per volunteer is reached. So we are conducting these observations consistently across the state to have a consistent window of observations, and each locations, every volunteer will start around 9 a.m. on every island. So and we recommend that people work in teams of 2 just for safety issues, but it can also work as individuals as well. Volunteers working in teams should observe 100 different people each. So meaning if you're working in a team of 2, your team should conduct 200 observations of 200 separate people. And we try to avoid double counting people. So in a way to avoid counting the same people, you would work with your team member to come up with a strategy so you're not counting the same people. So for example, if you are both decide to walk on opposite sides of the street, one person can count people on this side, the other volunteer can count people on that side. Or if you're stationary, one volunteer can count people walking this way, and the other can count people walking that way. So you come up with a strategy so that you and your team member don't count the same people and double count one person as much as possible. When you're conducting observations, the volunteers can choose to stay in one location or observe people as they're walking by. So it'll depend on the location. If you're in a very busy place like Prince Coelho Mall, and there's so many people at that location, you can probably be stationary and as people walk by, and you'll probably reach your quota within 2 hours. But if you're in a more sparsely populated area, like I think the Banyan Drive or one of the beach parks, Kikauka is one of these, a different one for me to say. If you're in one of those locations, you may have to walk a certain amount of way. So go in one direction, and as you're walking, observe people who are stationary. We'll leave that decision up to the volunteers once they get to the sites, because they'll know the conditions on the ground in terms of where people are. So while you're conducting these observations, we ask that volunteers be discreet. So don't interact with people, don't need to communicate with people or speak to them. We do this because when you there's this thing called the Hawthorne effect, is that when people know they're being observed, they change their behaviors, and we want to get people in their natural state as they're behaving the way they would. In some cases, some people may approach you and ask you what you're doing, and if that's the case, then you just tell them, I'm observing, I'm volunteering with the Department of Health to observe the use of face masks in this area, and that's all you have to say. We have a letter available to volunteers to show to authorities if they're questioned about what they're doing. It's signed by the Department of Health. It gives, if a policeman asks you, why are you here? You can show them the letter, say, I'm conducting official business as a volunteer for the Department of Health. Okay, and at all times, volunteers should be good role models for the community. So we should be wearing our face mask correctly, and we should be social distanced from other volunteers or other people in the community. And it's also for safety. Okay. Regarding the reporting of data, it's important that data that's collected is accurate as possible. So before you start the observations, the app that we have, and we're going to explain that to you, will prompt you for your name, your zip code of the location observation, and then the specific code in which you're conducting the observations. So when you input those things into the app, we ask that you be very careful that the information is accurate. We ask that we please don't make up any data. If you can't make the quota in 2 hours, it's fine. Just submit whatever you got. And make sure that when you are doing observations that you actually observe the behavior that you're recording. So if somebody's walking away and you see the ear holders of the mask, that's not a sufficient observation to say that person is wearing a mask. You should actually see them, their faces with the mask covering, to observe an observation. When you're doing these observations, you have 3 choices to mark your observations. So one is wearing a face mask correctly. The second is wearing a face mask incorrectly. And the third is not wearing a face mask. So we keep it very, very simple. And someone who is wearing a face mask correctly is one person who is wearing a face mask covering their nose all the way down to their chin. And anything else is incorrect. And of course, not wearing a mask, you just observe not wearing a mask. You want to observe anybody who appears to be 2 years of age or older. This is the CDC recommendations for use of face masks in public spaces. So anyone you observe to be 2 years or older, you can include in your counts. If you can't figure out if they're 2 years or older, like if they look too young, then just don't count them. Also, if some people are eating, smoking, or drinking, or exercising at the moment that you observe them, you can just not count them. To make it simple, we want the people who are expected to be wearing masks, and you don't expect to be wearing a mask when you are eating, smoking, or drinking. Okay, you're going to record your observations using a smartphone app if you have that, and if you don't, you can use the paper form as well. And we'll show you how to do that. Okay, so if you had questions about what does it look like to wear a mask correctly, you can see the mask should be covering your nose all the way down to your chin. So as it is on the left side, and anything that is not that is incorrect. So not covering the nose, not covering the mouth, or not being a part of the face is incorrect wearing. And I had a question about whether or not this counts as a correct face mask. When you walk in the store, you forgot your face mask and you do your best to cover your face. This is considered incorrect because it's not an effective way to cover your face. Okay, so if you see that, now you know using a shirt without a mask is incorrect. There are many different types of face masks, and it doesn't matter which kind it is. As long as they're wearing it correctly, covering their nose all the way down to their chin, you can consider that wearing a face mask correctly. Okay, so it's important to report the data accurately because our data is going to be collected and collated based on zip code, and we do that because we can overlay that with the other data that's coming in from other sources by zip code. So we're tracking testing by zip code, we're tracking other things. We want to be able to track this together. So it's really important that when you start observing that we accurately note down the correct zip code and the location code when you're collecting data. Okay, we'll show you how to use the smartphone app in a second. But the nice thing about the smartphone app is it's very simple, and it records your data simultaneously as you put it in. And so you push the button, it's automatically recorded. Once you've hit 100 observations, you don't have to push submit, you don't have to send anything, you just put your phone back in your pocket and you walk off and you're done for the day. Yeah, it's super cool. It's developed by a research lab here at UH Manoa. And if you are using a paper form, it's also very simple. We'll send you the paper form. There's just 3 columns and 100 lines on it. So you just put an X based on what you observe. At the end of your shift, you're going to just tally up how many correct, how many incorrect, and how many no mask. With that information, you can just email it to me, you can text it to me, or you can manually submit it into the website, and we'll show you how to do that. Any of these methods are okay. I want to stress that volunteer safety is our first priority. So when volunteers are outdoors, please protect yourself from the sun with a hat, with sunscreen, with the sunglasses. Wear comfortable footwear because you may walk. Have water on you and snacks just in case. And go out with a fully charged cell phone just in case, 1, you're going to be using the app. 2, if there's any emergencies, you can call for help right away. And then 3, if you have any questions about the process, you can call me or text me if you need. We ask that you stay safe by working in a team of 2 if possible, and when you are, remain 6 feet distance from each other at all times, or within eye view of each other. And of course, you should stop any observations and take any actions necessary to ensure your own safety if you or your teammates feel unsafe. So we know that the wearing of masks has been politicized in some communities across our country. If there's a situation where you're confronted or like someone seems upset, just stop what you're doing, just abandon observations, get yourself to safety if necessary, and then you can call me and let me know if anything unusual happens.
Gary, I have a question.
Go ahead.
Are you allowed to do this within your car? Can you stay in your car and still do observations?
Yeah, I think you can do it as long as you have a direct view of the people. Like I mentioned, an accurate observation is one in which you can see people's faces. And so we did have someone on Kauai who was at the farmer's market. She stayed near her car. She didn't stay in her car. We had another who just stayed under a tree. So they're in the shade and they just discreetly using the app. And the app is able to be used very discreetly. We did have one person who was approached because they were using the paper form to ask, hey, what are you doing? And they just told them exactly what it was. And they was like, oh yeah, I better, the person responded like, whoa, I better wear my mask then. Like, it was a positive interaction.
Yeah, okay.
So just gauge safety, but yes, you can.
So Gary, Carrie Glass, so the other question I had along those same lines, you're talking about working in team of two remain 6 feet apart. If you're working with your spouse, you don't have to stay 6 feet from.
That's correct. I should say maintain appropriate social distance. So it seems like you're very aware of what's appropriate. If you're from the same household, yes, there you can work together. Yeah. Very good. Yeah. Maintains appropriate social distancing for the situation. Okay. I'm going to turn this over to Daisy, who's going to explain how to use the app and record observations. And Daisy, make sure you're unmuted.
All right, good morning, everybody. My name is Daisy. Like Dr. Gauberman said, I'm the graduate assistant on this project. So we're just gonna go over the smartphone app really quick. So you'll be getting an email the week before your Saturday shift from 9 to 11. And in that email, there will be the link that's on this PowerPoint right now. The application that Dr. Glauberman is talking about, you don't have to download anything. You simply just have to click on the link and it'll directly lead you to the website that is kind of formulated like an app. So when you click the link, it'll first prompt you for your full name. So you're gonna enter your first and last name. After you enter that, it'll ask you for the zip code of the observation site. You can look at that through the sign up sheet when you go to sign up for your shift, along with the location code. It should be a 3-digit code just for our data collecting purposes. So before you log on to the app, just make sure that you know your zip code and your location code. It's very important that you input these correctly, because when we collect our data from different locations, we want to make sure that we're getting the right data from the right place. Okay, can we go to the next slide, or is there anything you needed to add?
That's good.
Okay. All right, so on the presentation, this is what the app will look like after you have entered all that information. The top will have your name, the zip code you entered, and the location code. And below that, it'll be the total amount you have collected, and then just broken up into subcategories of the data that you're putting in. So when you click, let's say you see somebody walk by and they have their mask worn correctly, you just simply click on the mask worn correctly button, and it will make a little cute sound to confirm that you have inputted that data. And so you just continually do that until you've reached a total count of 100. In order to, let's say you're walking, you kind of get distracted and maybe push a button, you don't know which one you pushed. If you scroll down on the application, it'll show you the last data that you just collected. So I can just, hopefully this works. Oh my goodness. I don't know if you can see.
Come closer to yourself, maybe.
Okay. Oh my goodness. Is this, okay, I don't know if I can just turn this off. Sorry.
If you hold your phone closer to your body, then it becomes part of your body.
Oh, that's so
So you
smart.
kind of
Okay.
there you go.
Oh, okay. So if you click this button, let's say I'm saying mask worn incorrectly, and I slide up, it'll show you that I just inputted that data. It says no mask and that it's submitting. So you can kind of double check just to make sure that you put in the right data. Is it still on share screen? Or I just stopped? Sorry. Okay. Any questions about that? Did that make sense to everybody? Yeah? Okay,
Yep.
great.
Yep.
Okay, so that's for if you want to input the data through the application. Like Dr. Glauberman said, after you get your 100 count, there's no need to submit anything. You're done for the day, you can go home. But let's say, for instance, maybe the internet doesn't work on your phone or you don't have a smartphone. We will be emailing you a form where you can manually enter in the data. So you would just go on the same application that same application through the link, except instead of inputting the data by pushing the buttons, you'll put manual entry, as you can see on the slide. And once you click the manual entry button, it'll give you different prompts to fill out. So similar to your name, the zip code, and the location code. And you will just tally up on your manually on the paper that you fill out, count the tallies of how many people wore it correctly, how many wore it incorrectly, and how many did not have a mask. And you would just put those numbers into the application, as you can see on the screen. This is one way of doing it. If this is difficult or this is not possible for you, you can always just email Dr. Glauberman or text him your results at the end of your shift.
I just wanted to add one thing about the app. So you don't have to download anything. So it won't take up any space on your phone. What we'll do is we'll send you a link to access the app. And it's basically a website. So once you click on the link, you put your name in, you put the zip code in, it'll just bring up this page, and it looks like an app, but it's just really a website with buttons on it. So that's one thing that's really nice about it. You don't have to download anything. And also it inputs all the data automatically. So at the end of the day, you don't have to go back and like recount up everything and re-input it. It's done simultaneously as you push the button. If you have any questions about like, hey, did that data actually record? Don't worry about it. You can text me and I can confirm for you. And also one thing that's kind of a little bit troublesome for the volunteers at this point is like, if your phone goes to sleep, if you don't notice anything for a while, your phone might go dark, and then you open it up again and your count is reset to 0. And you're like, oh man, I don't know how much, I've been doing this for an hour, don't worry if the count resets. The data is recorded simultaneously as you record it. So even if the count resets on your phone, the count has been uploaded into the website. So that's one thing I can reassure you folks about. But if you have questions about, was my data captured, you can let me know. And like Daisy said, if this is all too complicated and you're like, oh, I can't stand using the app, just use a paper form. And if you can't upload it onto by yourself, then just email me, text me. I had at this location, I had this many of these subtotals, and I can just input it directly. I will say that there were persons on Kauai, they're like, oh, I'm not going to deal with an app. But once they tried it, they thought it was very intuitive and easy. So try it out. If you feel like it's too much to do, it's no problem. We can use your paper observations as well. Okay, and I'm going to be standing by every Saturday, helping out volunteers, texting, emailing, and phone conversations to clarify any questions that people have or to allay any concerns. One of the major concerns was, hey, I wasn't sure if my information was uploaded. So I'd go into the database and I'd spit out the information that was uploaded, that zip code, to reconfirm with the volunteer and let them know that it was recorded. Yeah. So I think that's all we wanted to present. Are there any questions from participants today?
I also just wanted to add really quick, we also ran into some problems, or not problems, from the pilot from last week. People were wondering if they accidentally pushed the wrong button and said they were wearing their mask correctly, but you accidentally put no mask. We didn't input a like undo button just for the simplicity of the app. So if you can just maybe try to remember for like the next person who wasn't wearing a mask, just don't click that button for that person. We're just trying to make it super simple and not too complicated. And we understand that some results may be off by like a few, so that's okay. Don't worry about if you accidentally push the wrong button for a person.
Question.
Go ahead.
How do you find the location code?
How do you know the location code? So on the sign-up sheet, I've placed the zip code, location code for each location. So when you sign up, you should kind of note those two numbers down, the zip code and the location code. I don't know, maybe you guys know more than I do. Is there more than one zip code in Hilo?
No.
96720 for everybody? Okay, and does that extend out past Hilo at all?
Well, once you start getting out into Keao, into Pahoa, then you have different zip codes. But the locations that we're at right now that are on the sign-up sheet, they're all 96720.
Okay, yeah, so the zip code is the most important one. I do prefer, because the zip code is going to line up with the data from the Department of Health. The location code is for us on our side to like be able to separate how many observations have we had in this part of Hilo with this type of setting versus a beach park, for example, shopping center versus beach park. So that helps us kind of slice up the data on our side. But so one thing about the locations is locations may change. So you see on the sign up sheet that I have specified specific locations right now for the next 2 weeks, and it's blank right now after that. And the reason is because as the pandemic progresses, we may need to adapt as we go to see what's going on and what types of places we'd like to observe. So as you can see here, like it's right now, it's these 4 sections. I'm working in partnership with the Public Health Nursing Branch and Department of Health to determine where are the priority locations for each community. And so these are a couple that have come up recently. So we're hoping for this weekend and that we have at least, a handful of volunteers helping out, taking observations in Hilo. And then just a handful of volunteers each week, projecting out to the end of November at least. We think that things will change when the holidays come around, and so we'll reassess whether or not we're going to continue coming into December. But for this point, we're going to progress all the way through November.
Okay, Gary, and so right now the sign-up sheet is live now, right? So if people on this meeting or other people, they can sign up today and start into it tomorrow, right?
Yeah, and is this an effective way to, Benson, is this a good way to coordinate signups? Like, I think you guys have a better sense of how do volunteers sign up for things. And it's one thing that I don't know. So this is my suggestion of how it could be done. But if there's a better way.
I think probably for now, I don't know, Carrie, what do you guys think? Deb, if we just had a link and then we could all go to it, because we're talking about lots of different people that are in lots of different locations at the moment. If they could just bring the sheet up and see what areas are open. I know that if we could go in and fill some of these other locations in, all the way into October, I know there's people that would sign up, into October, because how I put it out to the Rotarians is that we're going to do this starting this weekend all the way till the end of the year. And so some of them, probably could only maybe do a couple of them, some of them 5 of them, some of them whatever. But I know, because this is how Rotarians think, is that they're already thinking, well, I could do maybe October 10th and I could do December 2nd or something like that. And they'll sign up for it if we make those locations available. They'll sign up ahead of time.
I think we're going to specify. I needed to double check with the Department of Health regarding locations. So I focused on this and next week, and then we will adapt. I'll probably get in touch with Department of Health either today or later on of next week and update locations based on their guidance. Yeah. Okay. I wanted to make sure we could stand up a program and have people pilot it, try it out this weekend.
Yeah.
To see, and then you can tell your friends like, oh, it was this kind of experience. I recommend you do this or that. So just trying it out for this weekend.
Okay. So is anybody on the call today? I got the sheet up that wants me to sign them up on any of the locations, because obviously we're starting tomorrow already, which is just 24 hours from now. So does anybody want me to sign them up, or I can send this sheet out to everybody? You can open it up yourself. Anybody want to sign up right now? Yes.
My first available would be October 3rd.
Okay. We'll wait till then.
We have plans.
I know. No, I got that. So I'm just trying to see if anybody is available to do something tomorrow. I'm obviously out of town, so I'm not available tomorrow. Okay. And
Hello.
Hi. Yeah, I can see you.
Okay, I can do
Yeah.
Lily Kalani tomorrow and the
Okay.
next week.
Oh, nice.
Okay, let's see.
I can go. It's like
And
really
what's your name?
Christine Jimenez,
Okay.
Jimenez, with the Gila Rotary.
Yeah.
So I can go from 9 to 11 to Lilio Kalani.
Okay. And Christine, what's your email?
bayhousehawaii@gmail.com.
Thanks, Christine.
Okay.
Okay. And then Christine, you said you had another. You want to go next week too?
Yeah, sure.
Okay, I'll put you in again. Oh, he's okay. Anybody else? They can. I can do next week because I'll be back in town.
Can you hear me?
Yes, I can,
Benson?
Sally. I can.
Okay.
I can hear you.
All right. I live by Richardson's Beach, and I was
Okay.
thinking I could walk out there.
Okay, great. Tomorrow or the next week, Sally?
Both of them. Both of them.
Okay, so let me put you
But
in
I'd
here.
like to have someone work with me.
Okay, I'll get somebody to work with you.
Okay.
Sally, what's your email?
SOBRIEN 27 at hawaii.rr.com.
Thanks, Sally.
Okay, Sally, and then
Thank
next
you.
week too, right?
Yes.
Okay, Sally, I'll be back next week, so I'll work with you next week.
Okay. All right.
It'll be fun. You know, we don't get
Yes,
that much time to hang out together. So
that's
People
right.
people have said it's fun. It's almost like a game if you use the app, but even if you don't, it's interesting to see people's behaviors regarding masks.
Sally, did I get your email right?
Yes.
Okay, good. And so let me I'll put myself over here.
Wonderful. I look forward to this.
Yeah, that'll be fun. Come. Okay. All right. And so it's one of these, this page is auto save, right, Gary?
Yeah, and we
All
have access to it simultaneously as well.
Okay. All right. So I'll see what I can rustle up today, and hopefully we'll have people out there tomorrow, and then for sure next week. I'll get, you know, I'll do the well, we did the recording on the sheet right here. Let me, anybody else want to log in over here before I stop share here?
If you could put me on the 3rd of October, if we're going to go that far,
Yeah.
are we just testing?
Okay. Where do you want to be? Just
I'll
Prince
do Prince
Coelho?
Coelho. Yeah, that's
Okay.
fine.
Okay, great.
Thanks, Deb.
Okay. And Hilo Moon, right?
Yeah, 1955.
All
It was a
right.
very good year.
That's a wonderful year. I love that year. That's at Gmail, right?
Yes.
Okay. All right. I know there's already, Gary, I had, when I sent the initial email out, I had about 7 or 8 people just say, sign me up. So I'm going to, when we're done here, I'm going to just load them in here. So I think we'll be good for tomorrow, but I will send them this recording so that they can at least go through the video.
Benson, are these individuals all in Hilo or are
Yes,
they in areas? Okay.
They're all in Hilo.
Okay.
And Benson, will you forward that link for the that we just watched, the instructions and the sign up sheet?
Yes, I will.
Okay, cool.
What we can do is we can put together an email for you, Benson, to mail out to your members regarding all the information that they would need, including the sign-up sheet. So
Great.
they can view everything that you would need all in one email.
Okay.
One thing we hadn't mentioned that we do need is when you volunteer, we need to request that you folks submit back a volunteer agreement form, and that will just give us your contact information, name, island.
Okay.
That way you're on our lists for if we're contacted by someone outside of this agency, like, hey, is this person a part of this engagement? Then we'll say we can confirm on our
Yeah.
our data. So I'll send that out with everything in there, and with the volunteer sign-up sheet attached as well.
Okay, cool.
Yeah, and then I think so what we'll do with regarding, I think for sure this week we'll keep it as is, but as I get more information from Department of Health, I'm going to go back and edit all the sites and fill those things in. So when I do, Benson, I'll email you again and say, hey, this sheet has been updated. Could you please resend this out so that volunteers can re-log in?
Right. I think Gary, as we get traction on this, I think there'll be more people involved. And so if every once in a while you want to have a check-in with the group, we can do a quick Zoom meeting, and people can kind of log on and get you some feedback or whatever you need.
Yeah, that's a really good idea. We could do that. I have regularly meetings with Kauai and Oahu as well. So that would be a good way to rekindle interest in the project if people forget about it, get busy with their lives. Yeah.
Okay.
And having that email with all the links on them would really be good. We can send out to the members.
Yeah.
I'm going to send it over to you, Carrie, in just a few minutes. Carrie's my man.
Question, I'm Junichi.
Hey, Junichi.
In the spreadsheet, the location code for the Kiro, Keaukaha Beach Park, and airport post office the same.
Oh, the same.
Oh, better change that. Okay. Thanks for catching that. I just put that up yesterday.
Yeah.
Yeah, you're right.
Yeah, Junichi's our catcher. You know, he catches stuff, man. That guy is like, can't get anything past him. So.
That's cool.
I've been trying for years, but Junichi, he's too smart, man. You can't get by him. Well, one of the things is today you can't even see him, so you didn't even know if he's around. He's like a stealth kind of guy.
Yeah, I have probably with the camera.
Yeah. Okay. All right.
Okay,
So
I updated. Thanks for catching that error. And if there's errors with dates or things like that, just send a message to me and I can fix it real quick.
Okay. Okay, Gary. So probably in the next few hours, I'm gonna populate the sheet. So I think we'll have a full crew tomorrow. I'm just gonna basically list down the people that said count me in, and then I'm gonna send them a thing that said, hey man, here's the link, go on, and then I'm gonna give them your information so that they can contact you. So Daisy, do we need your information? Can you put it in the chat so we can get you, or is that? Or we
Yes,
don't
I
need
can.
to, okay.
We can include it in the email. She'll be the one that sends the email out, and so you'll
cool.
have her information. She'll send it out, but it'll have my contact information there as well.
We love
and also,
that, man.
after your shift, we may be sending out a feedback survey. So if you guys have any suggestions or ways to make this process better or easier, feel free to leave your comments. We'll do our best to keep adjusting as we continue to do this over the next few months.
Yeah. Okay.
Great.
So right now, let me just say, I did marketing research for a few years, and this is super simple.
Yeah.
Yeah, simple is best, especially if you're working with new technology and people are stressed out, and we just trying to make it really easy for people.
Well, it worked out really good, Gary, because we've been Rotary, as you know, is a big service organization, and we're usually out there, I don't know, painting something, picking up rubbish, building something, whatever. And so we've kind of been grounded the last few months.
Yeah.
And so everybody's really wants to do something, but they want to do something that's safe and useful and important. But so when this thing rolled along, when I looked at it, I went like, wow, we could do this. Yeah. So yeah, we're glad to help.
Awesome. Thank you so much, everybody. If you have questions, just contact me. Don't hesitate. Leave a voicemail if I don't pick up. But if you email me, I'll respond right away. And take care. Stay safe in the field, and really appreciate your folks buy into this project. Mahalo.
Okay, Gary.
Thank you.
Daisy, thank you.
Thank you. Bye.
Have a good weekend.
Bye.
Bye.
Mahalo nui loa.
Bye.
Bye-bye.